Hello, my friends. I'm Dr. Jocelyn, a urologist and men's health specialist. And for the past 5 years, I've had the privilege of helping men protect something far more valuable than just their physical health, their confidence, their dignity, and the quality of their most intimate relationships. Today, we're going to have one of the most honest and, yes, perhaps slightly sensitive conversations you'll hear anywhere online. It's about a topic that men constantly whisper about in private, search for in the dark corners of the internet, or ask about with a hesitant, lowered voice in my clinic. But here, this is a safe, respectful space, a place where we talk about intimacy, vitality, and men's health without shame, judgment, or awkwardness. Because when we bring our deepest questions into the light, we don't just learn, we heal, we connect, and we realize we are absolutely never alone. Gentlemen, let me ask you this. Have you ever quietly wondered, is it safe to swallow vaginal fluids during oral intimacy? What about the taste? The smell? Is it normal? Is it healthy? These are real questions, questions that can make the difference between intimacy, feeling joyful, confident, and deeply connecting, or feeling awkward and hesitant. The truth is, most men don't actually know the simple biology and the beautiful science behind this. They live with unnecessary fear. So today, I'm going to give you the complete answer, medically, biologically, and emotionally. My goal is that you and your partner can enjoy intimacy with absolute freedom, zero shame, and a much deeper level of trust. But before we dive into the life-changing 5 mistakes men make, let me quickly ask you, where are you watching from today? Drop your city or country in the comments below. I love seeing this community of incredible men from all around the world learning together. And while you're here, don't forget to hit that like button and subscribe so you never miss out on practical, life-changing advice about men's health, intimacy, and vitality. Here's the first thing I need to correct for so many men. Vaginal fluids are not dirty, toxic, or shameful, period. For healthy couples, they are generally safe. In fact, they are a biological marvel, meticulously designed by the female body to protect delicate tissue, fight off potential infection, make intimacy more comfortable and deeply pleasurable. Yet so many men carry quiet, unnecessary fears. What if it's unsafe? What if the taste is strange? What if something is wrong with my partner? The truth is, variation is normal, safety is achievable, and communication makes all the difference. Once you truly understand the biology, you'll see that what often feels like a taboo is actually the body's brilliance at work. As a urologist who's worked with men across their 40s, 60s, and even 80s, whether they're finding new love, rekindling an old flame, or navigating a new health challenge, I've seen the way these silent worries can chip away at a man's confidence, connection, and even his sense of masculinity. And here's the pattern. The moment men truly understand how vaginal fluids work, what's normal, what's not, and how to approach this with care and respect, the shame dissolves. And intimacy, it deepens powerfully. So let's break this down. Here are the 5 biggest mistakes I see men make that inadvertently sabotage intimacy, connection, and their own confidence. Mistake number 5, thinking vaginal fluids are just moisture. Biologically, this is profoundly wrong. Vaginal lubrication is an absolute masterpiece of biological coordination. You have the Bartholin's glands releasing that silky fluid to reduce friction, the Skene's glands near the urethra adding more lubrication, and the cervix contributing protective mucus. It's a complex, balanced ecosystem, mostly water, yes, but also filled with protective amino acids, enzymes, glucose, and lactic acid. It's the body intelligently preparing for safe, pleasurable intimacy. Ignoring this fact is like missing the point of nature's design. Emotionally, when a man views it as just moisture, he minimizes the preparation and natural arousal of his partner. It becomes a mechanical event, not an honored part of her body's response, which lowers the emotional stakes and the pleasure for both. Practically, appreciating this biological process means not rushing and taking the time to let her body fully prepare, which makes the entire encounter better for you both. Mistake number 4, assuming taste or smell means something's wrong. Biologically, fluids naturally, beautifully, and healthily vary. Think of it like this. Your sweat smells different after a week of intense coffee and fast food than it does after a week of hydration and salads. The same is true here. Diet, hydration, stress levels, medications, and even the simple cycle of hormones can slightly shift taste and scent. Around ovulation, it might be more abundant and neutral. Post-menopause, it might be less plentiful or slightly more acidic. None of this is inherently bad, it's individuality. Emotionally, if you recoil, make a face, or hesitate because the taste is different one night, you are subtly telling your partner, your natural body is sometimes unacceptable. This is a huge hit to her confidence and trust. Practically, the only time to worry is if there is a sudden, dramatic, unpleasant change, especially if it's accompanied by itching, discomfort, or an unusual discharge. That usually just means a simple imbalance, which is easily treatable and should be discussed with a doctor, not reacted to in the bedroom. Mistake number 3, forgetting about health status. Biologically, yes, vaginal fluids are mostly protective. But like semen, saliva, or blood, they can carry infections if someone is infected, things like chlamydia, gonorrhea, herpes, or HIV. So the mistake is assuming fluids are always safe. The truth is, it depends on the health status of both partners. Emotionally, this is where trust is built. A man who understands biology knows that a conversation about testing and health is not unromantic. It's actually the ultimate foundation of trust and care. It shows you value her well-being as much as your own enjoyment. Practically, never rely on appearances. Being honest about past partners and getting tested regularly is the cornerstone of responsible, joyful intimacy. Mistake number 2, avoiding the testing talk. Biologically, as we just covered, the risk of infection, especially through oral intimacy, is generally low, but it is not zero. For example, any small cut in your mouth or a bleeding gum can create an entry point for an STI. Emotionally, one of the biggest barriers men face is the fear of asking, "Have you been tested? Should we go together?" They worry it will kill the mood or make them seem untrusting. But I've seen time and time again that when a couple gets tested together, the process makes them more open, more honest, and ultimately closer than before. The fear of the unknown is always worse than the reality. Practically, make STI testing a routine health checkup, just like you would for your prostate or your blood pressure. Get a baseline, especially with a new partner. Safety doesn't destroy romance, it strengthens it. Mistake number 1, responding with shame instead of acceptance. Emotionally, this is the most damaging mistake. If something smells or tastes different, many men, often unconsciously, recoil, make a joke, or offer a critique. But when you do that, your partner feels deep shame, and the door to intimacy immediately begins to shut. Biologically and practically, instead, respond with kindness and a team effort. Suggest a refreshing shower together. Encourage good hydration. Maybe buy some fun, sweet fruits for the fridge. Make it a collaborative effort. Acceptance is exponentially more arousing than rejection. When a woman feels fully accepted, her body, her scent, her fluids, her arousal deepens, her trust expands, and intimacy becomes more powerful and pleasurable for both of you. So, how do we shift from worry and guesswork to absolute confidence and joy? It's an easy 2-minute plan. Talk openly. Normalize conversations about fluids, taste, smell, and health. Make these discussions as casual as talking about dinner plans. Test together. Make STI testing a routine health ritual. If you have multiple partners, twice a year is responsible. If you're monogamous, get a clean bill of health together. Care for hygiene, hydrate well, eat a balanced diet, and don't underestimate the power of a quick shower right before intimacy. Stay compassionate. Treat changes or variations as something you face as a couple, not a problem with her. Celebrate acceptance. Remember, swallowing fluids is absolutely safe in healthy, infection-free couples, and for many women, it truly feels like the ultimate act of love and acceptance. Gentlemen, listen carefully. You are not too old for intimacy. Passion does not retire. Trust does not expire. And love, when cared for and respected, only deepens with time. If you've carried quiet fears or embarrassment about this topic, please let them go today. Know that thousands of men, millions, have the exact same questions. You are not strange. You are not alone. When you approach intimacy with wisdom, respect, and acceptance, you don't just protect your physical health. You nurture your connection, your partner's confidence, and your own sense of masculine dignity. And that, my friends, is what makes intimacy truly joyful at every age. So, is it safe to swallow vaginal fluids? For healthy, infection-free couples, yes. Is variation normal? Absolutely. The real secret isn't in the biology, though. It's in the open communication, the deep trust, and the compassion you share. Gentlemen, if you found this conversation helpful, please give this video a like so more men can see it. Subscribe to the channel because I release new men's health advice every single week. And tell me one more time in the comments, where are you watching from today? I'd love to know who is part of this growing, supportive community. Remember this, age is not the end of vitality. Every small, wise change you make in your health, in your habits, and in how you treat your partner brings back your freedom, your confidence, and your joy. I'm Dr. Jocelyn, reminding you, your health is your confidence is your connection, and passion truly has no expiration date. Take care, my friends, and I'll see you in the next video.